Well, there are huge challenges, particularly in current days. The first one is obviously the demand is growing. There is a growth in income of the populations, and with that goes expectations for more and better care, higher quality care, but also care which is delivering services that were not previously available. There is obviously an aging of the population, which is raising also the needs of individuals and making their needs more complex and requiring a response from health systems. And there are also issues related to technology developments, new technologies which offer large opportunities but also put pressure on the financing of health system. And all of this happens in a context in which health systems still struggle to transform themselves. They were very much created in the 19th century with a model which is not really fit for purpose to the needs of the current patients or the current populations. This has huge implications for health system. I mean, it is first a matter of financing. If we look at health systems which are based on social security type of arrangements, and so with financing coming from payroll taxation, obviously you will have fewer people of working age which need to support a larger share of elderly people. And so there are questions about the financing of health system and the reorienting of this financing towards more tax-based payments or pooled source of funding. So that's one first issue. There is then the issues that if expenditure raised in health system, how do we share really between the public and the private sector? And can we continue to sustain, 2/3 of the total health spending being covered by public system, which is what happens in OECD countries. And in a number of cases, there are questions whether this is possible, because that represents in OECD countries some already 15% of total government spending. So can we really crowd out more? We need to reconsider really the role of the public or the private system in financing. So that's one important issue. Then there is obviously the issues of all the delivery systems, so more the supply side, not the financing, but the supply side. And we have at the moment health systems which were created in previous centuries, and they were hospital-centric. They were about acute care, about an episode of illness, and which are completely out of fit with a population which is aging, which requires prevention, anticipation, continuity of care, and a much more community-based and primary care system. There are certainly a lot of opportunities for an evolution. I've mentioned already the issues of financing. There are questions about to what extent it's possible to further crowd out spending, government spending in other areas to finance health. So what role should private insurance, for example, have? It's a question for discussion. How do we share between the public and the private sector? Arguably using cost-sharing or co-payment arrangements is not a fair way of doing it. It's a much better way would be to define what is covered by the public system and what is not covered by the public system. So that's one first area. But there are then other actors in the system. Think about the revolution with technologies and with big data, with artificial intelligence. So huge opportunities which are there, but really a need to rethink of the health delivery systems and the way the different actors operate.